is Leanne, and I'm part of the Vancouver Startup Week team. I'd like to take a moment to acknowledge that we're grateful to be virtually gathered here on Indigenous land, regardless of where you're joining us from across, I believe we had said, the country and maybe the continent. At my home here in Vancouver, I am grateful to be on the traditional, ancestral, and unceded territory of the Musqueam, Tsleil-Waututh, and Squamish people. I'm privileged to live, work, and play on these lands. First off, I'd like to thank you all for joining us for VSW 2021, and welcome to this session, Set Up Your Health Startup for Success. Learn from the experts in the health and life sciences startup ecosystem, hosted by Venture Labs. This session today is part of our VSW Founder Track and is proudly supported by Sage Accounting. Sage knows that you didn't start up your business to become an accountant. Sage Accounting keeps your business organized and running smoothly. Track your cash flow, send out invoices, and get paid quickly. Visit the Sage Accounting booth to access free guides and templates for starting your business finances the right way and gain access to an exclusive VSW discount if you're ready to finally switch from Excel. I also want to take a moment to thank Venture Labs for being our event partner and also our sponsor. VSW could not happen without the continuous support from our community of sponsors. During today's session, if you have any questions for our speakers, please post them in the Q&A within the Whova platform. You can also upvote those questions to make sure that that question jumps to the top. Without further ado, I'm going to pass the microphone over to our speakers and we'll begin the session. Over to you.
Thank you very much, and looking forward to this great session. We have a really unique and special panel, and I'm going to start the panel off with a series of questions, and then I'm really looking forward to seeing our audience jumping in with your questions. Our goal here is to have a quite interactive session and learn from our panel's backgrounds. So, you know, health is one of the most challenging markets to succeed in. Products, they have more risk, the timeframes are long, investment is high, and yet some startups manage to do it and succeed wildly. So today we have two current CEOs with us. We also have a third that's been CEO, but we'll start by introducing our two current CEOs. Michael Ferguson is with Iogo. I fear I'm saying that wrong. Iogo has been twice recognized as one of the top 100 mobile health companies for their innovation in mobile health. And Michael, I hope he tells us a little bit about himself, because he's, you know, I don't know how he finds time to also be a grand champion in, oh, sorry, I'm reading my notes and confusing myself. How he finds the time to be a grand champion in martial arts, as well as lead a CEO and be a public speaker. Kaylin's
a father of four kids.
Sorry?
And a father of four.
And a father of four, oh my. Kaylin Zona is with Natural Cycles. Kaylin, I think, is located in New York, and leads their marketing effort. Although I believe your title is leading acquisition, but it's acquisition of customers. And that's one of the biggest challenges at startup space, is that how do I get those early customers? How do I keep getting the customers? And then I understand that for Natural Cycles, because you're FDA approved, how do I keep doing that in an FDA regulatory environment? So really looking forward, Kellen, to hearing from you, and looking at your background before you joined Natural Cycles. I can see why they really needed you, because you have a background in marketing and a background in marketing health products into the US. So really interested to hear more about that.
Yes.
And Courtney Zhu is, oh Dan, did I say that one right? I'm probably having a great day with names. Courtney Zhu leads venture acceleration at Matter, which is a global healthcare accelerator located in Chicago. And so she's spent a lot of years helping companies figure out the healthcare markets in the US. And one thing that's kind of particularly interesting, I think, for our audience today is that Matter partners with the Canadian Trade Commission and runs a program I believe it's now called Point B, which helps Canadian companies reach into the US market. So it's going to be really interesting to hear from Courtney about some of the challenges that are particular in the complex private and public payer market in the US. And last, I want to introduce Natalie Dakers, who is, as I said, a CEO, a board member. She's on the board of Stem Cell. She's on, and she's also on the board of Auguras Life Sciences. And we're really, really lucky to have her having joined us as a mentor in Venture Labs, where she helps Venture Labs companies figure out their strategy and make sure that they're looking ahead in healthcare and understanding where are they going to go commercially and what does that mean to their product, their market, their business strategy. So with this really innovative panel, what I'm going to do is ask each panel to give us a brief introduction to themselves and their company or their organization, and then we'll head on into some questions. So Michael, do you want to lead us off?
Sure, happy to do that. I think I should probably first say that I saw my name go by in a slide earlier, and in case people are Googling me, my name was spelled slightly incorrectly. Ferguson has 2 S's, Michael Ferguson. Makes me easier to find online. Yeah, I'm the CEO of Ayogo. We founded the company in 2011, really to pursue a mission. And I think, always that's the best way to build a company, is to build from the mission out. Our company wasn't founded to commercialize a technology. It wasn't founded to pursue a particular market or particular business model. Our mission was to create a space in which people that we really wanted to work with, some of the smartest and most compassionate, kindest people would find a home, a place where they could do their best work. We have an internal motto at Ayogo, which is do your best work, change the world, and laugh every day. And we built the company around this vision from the start. And by accumulating excited, smart, motivated, heartful people, we would develop a business. And together, I think we've done a good job of that. Our backgrounds, we didn't come without backgrounds to the business, of course. Our background as a company is cognitive neuroscience and behavioral economics. 80% of, as much as 80% of patient outcomes are attributable to non-clinical factors. Psychosocial factors that drive behavior, drive decision-making, drive what it is like to really be a person in the real world, away from the point of care. And it turns out that managing, tracking, assessing, and gleaning insights from those psychosocial factors is extremely difficult to do from the limited vantage point that most clinicians have at the point of care. So our company's mission, our product built on our mission, is to provide tools that allow clinicians to understand what it is like to be that patient, to tailor their care to the patient, and to unify their clinical care plan with the patient's life plan. And one of our early insights was talking to patients with type 2 diabetes and their physicians. The physicians would say, we'd ask, well, what is your goal for this patient? And they would say, to reduce their hemoglobin A1C. We need to get their A1C down, below 7 or whatever it was. And we talked to the patient, and the patient says, well, my goal is to travel next summer when I retire and not worry about going into a diabetic coma in a foreign country. Well, our insight was these are actually exactly the same goal, and they're just stated in different ways. And what we need to do is provide a translation layer between those two conversations that are happening to allow patients to really internalize and integrate into their life what their clinicians want them to do, and their clinicians to gain the insight of understanding what it is like to really be that patient in the real world and incorporate it into their practice.
All right, thank you very much, Michael, and apologies about missing the S.
That's okay. My grandfather would insist that I correct you, so I'm just channeling the old Scott in my family.
All right, let's head to Kellen. Kellen, can you tell us about yourself and about Natural Cycles?
Yeah, of course. So I'm representing the continent. I was in New York, but now I'm in Texas. but it's a US headquartered company. So I've been with Natural Cycles now for nearly 2 years. Natural Cycles is the first FDA and CE marked birth control app. It's a digital form of birth control. You use a thermometer to track basal body temperature, and the app, there's an algorithm then that pinpoints ovulation and provides a daily fertility status. Now, while I'm fully aware that I am a gay man talking about birth control, I will then talk about my experience of what led me to this position and how I'm driving growth at Natural Cycles. So previous to Natural Cycles, I was in subscription marketing at HBO and Showtime, and then have experience marketing and launching healthcare supplements in the US and scaling that up quite tremendously as well for a company called Nutrafol, which was a supplement. So yeah.
Great. Thanks, Kellen. And Courtney, can you tell us about yourself and about Matter?
Yes, absolutely. Thank you for having me today, and thank you for the kind introduction earlier. So just to reiterate, I lead the venture acceleration team at Matter, and a little background on Matter. So we are a global healthcare technology incubator and innovation hub headquartered in Chicago. And our mission is to bring people together with organizations to transform ideas into solutions that improve the healthcare experience. And we do 3 things in service of that mission. So first, we incubate startups. Since we launched 6 years ago, we have worked with over 500 companies that range from very early stage to growth stage, digital health and life sciences companies. And we have a suite of programs and services to help them bring meaningful healthcare solutions to market. The second thing we do is we have worked with over 130 large organizations since we launched, and these are health systems, life sciences companies, health plans, to help them achieve their innovation goals by helping them either source and co-develop solutions or think through complex challenges. The third thing we do is that we're a nexus for people who are passionate about healthcare innovation and transformation. So we bring people together to be inspired, to learn, and to connect with each other through a variety of public events. And like Virginia mentioned, this is our 7th year in collaboration with the Canadian Trade Commission and the Consulate General of Canada to run our annual Canada Chicago mentoring program, where we support a cohort of Canadian companies in refining or scaling their go-to-market strategies. So very excited to chat today and be part of this discussion.
Thanks very much. Great. And Natalie.
Hi, everybody. Good to see you. Thank you, Virginia. And it's great to meet my fellow panelists. So myself, I've been involved in early stage commercialization for a long time, kind of in an interesting road myself. Originally tech transfer in a university when the whole startup biotech industry was growing in Canada. So I feel a little bit like I've grown up with the biotech industry. I went on to start a company with a professor that I'd worked a lot with. We created a company called Neuromed, which was developing drugs for chronic pain. Brought that literally from a formula on a napkin to a clinical stage company that went public. Unfortunately, the drug didn't work, but that happens. And then got more involved in the big picture and innovation because I was interested to enable more scientists to do a better job bringing their ideas to fruition. So along with a bunch of very cool individuals, largely out of UBC and SFU, we created the Center for Drug Research and Development, which was really the first translational center that we had in Canada, which allowed scientists to come with their cool ideas into a neutral ground with a very sophisticated infrastructure to essentially gather data to see if there really was a therapeutic behind their ideas, which led me to more interest to get early stage funding into these companies because the mandate was really to spin off as much as we could based on these early ideas. But to do that effectively, you need money. And that's a tough thing. That's the valley of death we all talk about. So we created a accelerator, first national accelerator in Canada based on health innovation. We called it AccelerX. And basically invested in companies from an early stage to essentially get them ready for a Series A. And along the way, I've been on boards of a number of companies. I've worked in different environments. So I guess today I find myself doing a number of things, and one of which is an EIR, as Virginia mentioned, at the SFU Venture Labs, which, you know, we're here to really help these companies become what they hopefully, you know, their potential shows them to be. So today we'll talk about all kinds of interesting things related to that.
Great. Thanks very much, Natalie. So what I'd like to do is start off with a question that I'll kind of pose to the whole group and start with you, Natalie, but it's really a question around what is the biggest challenge that you see companies facing, or the one thing they kind of need to do as they're setting their plan to go forward and thinking about how am I going to do a startup in the health space. So Natalie, you and I have talked a bit about really the need for this kind of clear thinking at the beginning. So maybe you can tell us what you've seen both in your companies and in the companies at Accelerex and today. What are companies not thinking about, or what are they thinking about, and that helps them succeed?
Yeah, it's, you know, it's an interesting question because it's obviously, we could take the whole time and talk about that. But I guess if I was to generalize, especially when you think about how much we're seeing success between technology entrepreneurs coming together with health entrepreneurs to think through their applications, it's really understanding where that product fits in the big picture. And we can see that from many different ways. But I guess the thing that first off, we hope to see with these early stage companies is, do they really understand the nature of the product that they're trying to ultimately develop? And how are they differentiating themselves in the marketplace? And that in health can be pretty challenging, right? Because it comes with all kinds of qualifiers. And I think probably the single biggest thing that gets some of these companies hooked up, I guess, challenged is, have they really thought through the regulatory question? And this is, I see much more in the circumstance where you really are merging new technology into a health application. It's a very straightforward question if you're developing a drug or if you're developing a known medical device, because it's the immediate thing that you know you're up against, that you have to be thinking through what that regulatory path is. But we have the benefit of this convergence of technologies that are allowing applications to be used in the healthcare world. But I think what we're seeing more and more is that there is an underestimation of how the regulatory path works and how that's going to affect how you might position your product into the marketplace. So that's something that we have to spend a fair amount of time with early on, because what you don't want to do is spend a lot of time and energy only to find out that you really can't exploit it in the way you had hoped because you didn't go down the right path. The other thing that affects is ultimately how much money do you need for such a product? Because anytime you enter into the regulatory world, the costs of development just obviously are significantly higher. So I think if I had to sort of put a circle around something that's been probably one of the things that's had to have a company really switch gears, would be underestimating that understanding.
Thanks. Courtney, do you want to comment on what you see as all the startups that you're working with?
Yeah, I think specifically as it relates to the US healthcare market, I mean, people always hear the phrase misaligned incentives, which ultimately boils down to the fact that the ultimate consumer of any product or service aren't the people paying for it. So the ability to then navigate the complicated web of stakeholders between the provider and the patient is really, really challenging. And I think the biggest challenge I've seen among healthcare entrepreneurs, both kind of outside the US and within the US, is, you know, no matter how compelling your solution is, no matter how much this is the right thing to do, the business case needs to be clear. And I think many startups operate with the notion that, why wouldn't anyone buy my product if this is going to help improve health outcomes? But I think needing to have that clear ROI articulated of, how you're either driving revenue or saving costs is going to be important in navigating any stakeholder within or any buyer that you're approaching. So I think understanding their customers so deeply to the point where you know exactly who within that organization has the budget and decision-making power to eventually drive the adoption of your technology is really key.
Totally see the same thing with the startups here in Canada, understanding who the buyer is. Quite often it's not the user. Michael, you're nodding. What's your take on some of the hardest things that you've got to have had to do, or the most critical things you've had to do to succeed? Oh,
I just really love what Courtney was just saying. I mean, I just think that's deeply insightful and can be profoundly counterintuitive to somebody who's coming to healthcare from outside. So the first wave of digital health entrepreneurs came from tech industry, right? Here we're here from Silicon Valley, and we're here to disrupt this thing for you, right? And it turns out, well, it's true that the healthcare system is a target-rich environment, in the sense that there are lots and lots of problems to solve, many problems, many challenging, sometimes apparently obvious problems to solve. It turns out that you can make a thing that really helps people, even saves lives, that you literally cannot sell. And that is a hard lesson to learn if you are coming from the tech side, where you got a problem, I'll just fix that for you, right? But that's not how it works in healthcare. And nobody in healthcare really wants to hear about how they're being disrupted. It's the opposite, right? The whole industry represents the most conservative buyers you've ever encountered in any part of tech. And it's just a completely different environment. And you have to be, as you say, it's a multi-stakeholder environment. Each of those stakeholders you could imagine is connected by a pipe, and there's money flowing through that pipe. It's really hard to tell sometimes from the outside which way that money's flowing, right? Who's paying whom for what exactly?
right.
And there are a lot of business models in healthcare that have been developed that rely on obscurity or an imbalance of information or rent taking. And there's a lot of ethical traps there for entrepreneurs as well. So I think, to me, the biggest challenge for any entrepreneur working in this space is to construct a business model that works economically, that works practically, and that works ethically. Because I think we really underestimate the importance of constructing ethical business models in an environment where the key stakeholder, the patient, really is not in a position to make any decision at all about the product that they are receiving. And that is a profound responsibility. I mean, it's a responsibility that lives in other places too, right? Your Facebook and your whole business model is based on manipulating people's behavior below the threshold of their perception. I think that is a really profound moral responsibility as well. We have it in spades here in healthcare, where we have that responsibility that I just mentioned, and then layered on top of it, this other healthcare responsibility. So I think that's, to do that well requires grit, talent, experience, knowledge, resources, time. I mean, you just have to accumulate so many things in order to execute effectively on that. But it all starts from this, fundamental seed of understanding the real problem, which is
the problem and your business plan. Kellen, I have a suspicion that both of these are resonating with you, with being that you're in a regulated market, but uniquely you are selling directly to the consumer, but with advice from their practitioners.
Well, I was going to say again, as another important factor is getting the medical field buy-in, or at least having a medical advisory board, or having someone there, because if you're going direct to consumer, you still understanding that audience, their first point of questioning will go to a medical professional. And if they've never heard of your product or they don't understand it, they're not going to recommend it. There's been years of education and thousands of dollars put into what they know. So offering an alternative solution, it will be dismissed. So I think having an understanding of how the medical field will view it, ultimately buy in and support it, is also incredibly important for any D2C healthcare product, for sure. For us too, going through natural cycles, going through the regulatory process, it's also incredibly important because it establishes trust and validation. So, so many things up against you, and I'm speaking like a true marketer, is to get noticed, but also support that notice. You need third parties. You need these types of things that consumers understand, shorthand, as far as pushing forward or even appealing to who you know is your target audience. So understanding the regulatory process, going through it, understanding then what comes out of that is your guardrails of how you can market it. So that may differ from when you initiate. You may think that you can say whatever you want and you cannot. And following that, because that just further sustains the trust in what you're doing and what you're marketing.
And I imagine that means that unlike a Silicon Valley company, you have a large team on the regulatory side.
Yes, a large team, a very impressive process. And there's annual audits that go into place. Those are done by third parties, and there's incredible training about what it means to be a regulated product. And that's also something that we have to document and share, and then that's all part of the auditing process as well. It's an extension of brand guidelines, the regulatory approval, if it makes any more sense, and it's a necessary component.
Right. And that kind of weaves back to both the business. You need to get your business plan and your commercial plan right, and you need to be thinking about that ahead of time when you resource your business. So, Kellen, let's stick with you for a minute and dig into how does Natural Cycles find your customers, and how do you I'm sure that it's probably not just because you have bags of money that you can throw at Facebook ads.
I wish. Yeah, well, first, it starts from the top, and we'll give credit to the founders, Alina and Raul. They're both particle physicists, so they absolutely love data, and that is an ethos that permeates throughout the entire company. So understanding of any decision-making is anchored in some data point, which I think is incredibly useful. So we're not going off a feeling or a hunch, or if we are, it's reinforced by a data point so that we know what we're doing is either scalable or we can adjust accordingly. I think what everybody was saying earlier as well is when you have a product in a go-to-market strategy, truly understanding what your unique selling point is. So for example, why would a woman be interested in Natural Cycles? Identifying a few key reasons. So if that is your hypothesis, then supporting it with data. So consumer research, structuring a testing model then as well with some budget, if it's not infinite in social, to get to those answers. So say that you have three, being it's a non-hormonal solution, it's not, there's no prescription needed, and it puts more control into the women's hands. So say that those would be the three, checking with regulatory that those three can be communicated properly, and then establishing a structure then that tests into it with the key demographic in your initial consumer research.
Is there any tools that you use that you would that you see as really valuable, and if somebody's sort of starting out with their digital marketing, you'd say, go have a look at these?
Well, we initially used Facebook Insights, but I wouldn't recommend using those anymore because they don't exist. But I would say partner with a consumer research firm, at least to get an understanding, for sure.
Interesting. Okay. And switching, Michael, I know that part of what your apps do is I'm picking up on Kaylin's comment of putting the control in the individual's hand. You have apps that talk about doing just that, helping the patient or the individual take control of their well-being. Can you talk a bit about the kind of the direction of your product, and actually I want to know how the belief sets and your mission helps you inform your product development?
Well, yeah, I mean, those are good questions, and any one of them could be a whole conversation on its own because there's a lot there. But we are
deeply interested in what is true, and not just what feels true or what people will tell you is true, but what is actually true. And so much of the time, we don't even understand our own behavior. We don't understand why we're doing things, why we make the choices that we're making. Sometimes that's a lack of knowledge. We just simply don't understand how the medication works. I mean, frankly, for most people, medication is magic. It's literally magic. I mean, there's a ritual every morning where they put the pill in their mouth and they swallow it. They have no idea how the thing works. And so, which you know, you can chuckle at that, but I mean, I think it's a reality that we have to recognize that for virtually everybody, pills are magic, and what makes something magic is whether or not you believe in it. And when a person ceases to believe in the magic, right, it doesn't matter that the pill actually works. They actually have ceased to believe that it can work for them. And so you have to understand, you know, the relationship between belief and behavior, which is why, you know, we're so focused on behavioral economics and cognitive neuroscience as our path to understanding, you know, the sort of the dual aspect of our human behavior. What is it that we feel and believe? You know, what are the little bugs in our software that make us behave irrationally? What seems like an irrational way in a certain circumstance? And then what are the underlying biological neuroscientific realities of the human brain? These are, you know, say 80% of patient success is related to psychosocial factors. So these are not just trivial secondary questions. I mean, this really drives the heart of what makes a patient successful on any form of therapy over the long term. And, you know, understanding from that, we can develop strategies to help people. But just as importantly, we can feed insight to clinicians who, whether they like it or not, are magicians, right? To the patients, and they have to understand, they have to have some insight there. When they speak about things a certain way, it lands a certain way with the patient. And then, but how can you tell how it landed? So here's a classic use case for us. Patient who has, you know, late stage kidney disease, their glomerular filtration rate falls below 25, say, and it is predictable. Sometime in the next 26 to 24 months, they are going to need some form of renal replacement therapy, almost certainly. Right? And so the first step is go and talk to a nurse educator and get educated about your choices for different kinds of renal replacement therapy and how they will fit into your life. You just need to understand this process. So you go and talk to a nurse educator who spends a lot of time, very knowledgeable, very smart, very committed people play those roles. And they spend, you know, they take time, they talk to the patient, they explain as much information as they can, and they say, do you feel like you're understanding what I'm saying? And the patient will say, yes, you know, I feel confident because you're confident. You know, you're lowering my anxiety. It's great that you're here. I feel very supported by you. And then the patient will leave and go home and be completely overwhelmed with anxiety. It turns out that they really didn't actually understand. You know, they were given a question. You should talk to your spouse about what it will mean for your sex life to have a machine in your bedroom with you every night, say. But they actually don't really remember why they're supposed to ask that question. It felt like they understood it in the moment, but now that they're on their own and they can't just turn to the nurse and say, did I understand it? You know, they're overwhelmed with anxiety and paralyzed. Or they're not, or they're motivated and they feel supported and they do understand what they need to do, and they are able to engage in those conversations, but you can't tell the difference. See, the nurse can't tell the difference. And it is that lack of insight into what is actually going on in people's lives, that connective tissue to connect a motivated, well-educated, highly trained professional with the uncertain reality of a person's life, you know, where you're surrounded by people who are unqualified to be making decisions with information that's very nebulous, where most decisions are made emotionally, not rationally. That is the opposite of the clinical environment for the most part. So creating the connective tissue is really important. And to do that well, we must recruit people who are deeply empathic. So it is a really important part of our whole business and how we think about constructing the business and how we do our recruiting and how we recruited our investors and how we talk even to our customers. You know, one of the first things we say is, what does compassion mean to you? And do you value it? You know, often when we're talking to new recruits, you know, people we're recruiting into positions,
applicants for open positions in our company, that's a question we'll ask. What does compassion mean to you in a professional context, and how have you experienced it? And most of them say that no one has ever asked them that question before.
I can understand that.
Right. And in an environment, in a business that is about caring for, care is right in the name, health care. You think caring would be one of the very first things you would talk about, but it turns out we don't talk about that very much. And I think that is, part of the secret sauce of our company is to talk openly about this internally and externally with our customers. And it drives our approach to the way that we do our work: compassion for ourselves, compassion for the patients we're serving, compassion for the clinicians who are really just trying to do the best they can in an environment where they don't have all the tools at their disposal all the time that they would like.
And when you talk about your customers, you have the end users and you have the clinicians. Who do you sell to? Who's your buyer when we talk about the business plan? Where's the money in your picture?
Well, first thing I would say is we don't actually consider the patient to be our end user.
Okay.
Right. So here's an analogy just to help illustrate it a little bit. So I just recently did a renovation on my house, right? And the contractor had a portal that I used to track the progress of the project. Well, the company that sold that portal to the contractor doesn't consider me their customer, right? I'm not their user, the contractor is, right? But it's designed for me to use on behalf, right? So that's how we think about it. What we're doing here is really delivering tools to clinicians. Our primary user is actually a nurse for the most part. And he or she is responsible for caring for patients, and our job is to help him or her do that, right?
But the nurse is probably not the person with the money.
That's right. So complex multi-stakeholder environment. That nurse works for some clinical healthcare delivery organization. They don't pay for therapies that they deploy, right? They get paid to deploy therapies. So we don't think that's a very good customer. So we try not to sell to healthcare organizations where we can. There's a bunch of reasons for it, but one of those is we don't want to encumber the healthcare system with costs. So, somebody once asked John Dillinger, why do you rob banks? And he said, well, that's where they keep money, stupid. The question is, who has money, right? Who's generating profit? Who has got a spreadsheet with a cell in it that when they're successful, that number goes up? So in the healthcare context, when you're successful, the number goes down because you're spending money and spending budget. It is the vendor of the therapies that we work with. So we provide patient success programs that we wrap around approved therapies that are delivered to market. And then there's more to our selection of a customer than that. Say there's a really important ethical component to how we think about our business. So, without going into a lot of details there, we don't want to be in a position where we're helping one pharma company steal market share from another pharma company. That doesn't help patients. What we look for vendors who have more or less dominant market position, where the objective is to get more patients onto the correct therapy. And it doesn't matter which therapy, whether it's the one that has 10% of the market or the one that has 90% of the market, and we go to the one that has 90% of the market, and they're happy to deliver something that supports all patients, which we think puts everybody's interests in alignment. The patient, the physician who's not interested in helping one company profit over another, right? Just wants to deliver good care to the patient. We think that keeps everybody's interests aligned. So that's how we think about that.
Challenging.
It is challenging, but we've had a lot of success with this model so far, and we're really pleased with it. I think, like I said, a lot of the lessons we've learned here about business models in healthcare can be quite counterintuitive to somebody who's coming from more mainstream technology business. But as Dan Ariely once said, just because it seems irrational doesn't mean it is, and it's predictable, and you can understand it, and you can build your business models around it.
Okay. Courtney, picking up on the who's the buyer, who's the customer, and what do you see, and how do you help the companies that come into Matter figure that out, especially tell us a bit about the complexities in that US environment.
Yeah, I think within the US environment, it's about, I think the most effective business models that we've seen are those that have a sound value proposition for multiple stakeholders. So, your initial target market could be, the provider market, but then our role is to help them understand, the complexity of the sales cycle, the length of the sales cycle. And I think especially that first enterprise customer is incredibly challenging to secure. And I think that's oftentimes kind of the rate limiting factor for a lot of companies, and especially also if they are seeking capital injection, then a lot of funds won't look at you unless you have some kind of demonstrated product market fit. So a lot of our companies I kind of classify as they're figuring out their go-to-market and figuring out how to get this in the hands of the end users to get that data such that they can start to position themselves well for investment. But then the second phase is kind of getting to the point where you have an actual replicable sales strategy. So the point at which you might have 2 or 3 customers, but it's not replicable yet. You're not you don't have a sustainable sales engine to truly hit that inflection point of scale. So our role is to kind of be there, surround them with mentors and subject matter experts, classes. I think having just a lot of this foundational knowledge and understanding the gaps is really critical. And I think being able to be there as a structural support system or sounding board is kind of the role of an incubator like Matter. But again, I think for thinking about companies that are coming from outside the US, it's a completely different set of challenges, especially with Canada that operates the single payer system. The incentives it's still challenging, and the incentives are more aligned with that, where you're in a market where you're dealing with private insurers, government insurers, and those organizations have their respective innovation engines such that it's different across the board. So Matter, we have the kind of corporate innovation side of the house where we can kind of get some insights into these large kind of more bureaucratic entities and what their innovation goals are, and try and kind of be a synapse between the kind of 2 sides of our business in really bridging that gap and accelerating that collaboration, because our foundational belief is that that's the only way you can bring healthcare solutions to market. And so
it sounds like it could be really helpful, and I hope some of our audience will look up the Canadian Trade Commission program with you at Matter, because I think having some of those connections into the US market could be really helpful.
Yeah, absolutely.
Natalie, we've talked about how often what the first thing we hear at Venture Labs is, from when we ask a startup what do they need, they need money. And you've talked about how the availability of money is really changing, and sometimes it's not that they need money, it's that they need something else. So can you talk about how you see the funding, how it's changed over the years, where we're sitting today, and what's the key thing that our startups in the audience should be thinking about if what they're trying to do is go raise?
Yeah, it's like that old adage, real estate, location, location, location. Venture companies think money, money, money. But the good news, it's a bit of a good news, bad news story right now. Well, maybe not bad news, challenging news, in that I don't think we could have imagined how profound the impact that COVID has had on our, call it, our environment here. In that I think it's certainly been very effective in shining the light on the value of science and how what that means for society. And also, frankly, the big bad pharmaceutical company. It's kind of amazing when you think about the public's perception of pharma, but I think we've all learned a lot through COVID, just the value of what this means to us and the remarkable innovation that's been done in just incredible timelines. So I think all of that is super positive, and certainly the trickle down to the company is that there's more money out there for possibly venture funded companies than there has been for years. I mean, if you look at 2008, if I speak specifically in Canada, we saw such a contraction of monies available as a result of that. We saw most of our venture funds diminish, their ability to raise funds from limited partners diminished. And it's been sort of a slow increase over time. The good news is it's been getting better, but COVID has just like, it's like when you look at, you know, funds being raised, and not just in Canada, obviously everywhere, there's just a remarkable amount of money out there. Not for every company though. I sit on a number of boards, and it's sort of a polar discussion of the company having available money and companies that are really struggling to gain that money because they don't have a COVID story. So there's a bit of a challenge in that way. And of course, you know, many companies have been impacted by their ability to get in to hospitals, get into institutions where they would be typically running their clinical trials. So their ability to gather their data so they can build their story, you know, has really been challenged during this time. So that's why I say there's a bit of this good news, bad news story. But, you know, getting back to specifically one of the things that you're asking about around companies is, of course, everyone needs money to build a company. But I think the underestimation can be, well, what are you going to do with that money? And what is your company positioned to do that? Because I think the thing that I find quite surprising still to this day, especially given there's so much mentoring going on supporting companies, is the underestimation of people. And it's come up in a number of these conversations from everybody on the panel, is that you know, the phenotype of an entrepreneur, a successful entrepreneur, is, you know, they can do everything, but it turns out not really. Successful companies come from building terrific teams and really recognizing your weaknesses and going and finding the smartest people you can and surround yourself with the smartest people. And I still to this day find it really surprising when you talk to people where they're setting themselves up to raise money. You ask them, well, what does your board look like? What's your advisory board look like? Who are your key opinion leaders? Like, who besides you guys are you surrounding yourself so that you can, you know, make good decisions quickly? And, you know, it's just the same old, same old. You can see bandwidth being a massive issue, but yet not concentration on people. So I guess my feeling is, if you're going out to raise money, your team is going to be the single biggest thing that they're going to evaluate. And that team has all kinds of flavors, but don't underestimate how important it is to be beyond, you know, that entrepreneur that has that brilliant idea.
Right. Yeah, that certainly resonates. Michael, I see you nodding. Do you want to add a comment to that?
Yes, that is absolutely, completely true. And, you know, I think someone once defined an entrepreneur to me in a way that I thought was really great. You know, a business person who pursues a goal without regard to resources currently under control. And, you know, that is a certain kind of personality, right? That is willing to take on that kind of risk to build something that they know they cannot build because they don't have all the things they need to build it. And they're going to have to go and, you know, get the parts for the plane as they're flying the plane, right? There's a certain kind of person who's going to do that. And I think that that personality type does tend to be a go it alone, I know what I'm talking about, you know, if I speak with enough assurance, people will just accept what I'm saying is true. And probably have had the experience throughout their lives that they're just the most confident sounding person in the room. And everyone's like, well, okay, well, let's just do what that person says because they sound like they know what they're talking about. And that can lead you to make some really poor decisions. And this sort of slightly narcissistic thread in most entrepreneurs' personalities does lead to bad decision making. And just Natalie was just pointing out, I think, exactly where so many companies fail. I think ultimately for a lack of talent. They might say, oh, we ran out of money. Well, it's because you didn't have enough talent to get the money. Oh, we didn't have enough market knowledge. Well, it's because you didn't have enough talent to go and get the market knowledge. You know, so much of it comes back to talent. And it cannot, first thing you have to realize to be a good entrepreneur, to be a good CEO, to be a good founder is
You literally cannot do it. One of the resources not currently under your control that you need to go out and find is talent, experience, and grit. You got to bring those into your business. And if you don't bring them in, you're going to fail.
So let me ask all the panelists, how do you go find the talent? And let me start with you, because you're kind of bridging off your thought, Michael. How do you go get talent? And how did you do it in your early days when you weren't already a success?
Well, so Yogo is my 5th company, and I've learned a lot about this over the years. You know, had failures that are attributable to, you know, hubris on my part and a lack of collaborative energy, you know, and made lots of mistakes there. And so, you know, but having made those mistakes gives me resources that other entrepreneurs don't have, right? So, you know, I started Yogo. I can call 50 or 100 people that I really have confidence in working with. You know, they may not have necessarily the skills or experience for my particular company right now, but I know they're good people. I know that they have a big heart. I know that they're really smart. I know that they're motivated in the right way. And that is a huge part of it. So, you know, that is the starting position. You want to, if you're thinking one day of starting a company, or even if you're got one now, you have to be nurturing your network. That is really critical. The network is how you recruit, either directly or indirectly. And then when we recruit indirectly through our network, that is, I'm talking to people who I don't know directly, but know people that I know, I start with values. I start with values always, because that's actually that's the hardest thing to get a match on, in my experience. You can get somebody who is great, super talented. They don't match. If you don't have a values match, that person is going to harm your business. So you've got to match that. You got to test for that first, test aggressively for it. You know, be really clear about your values and mission as a company. And then from that group of people, you find the ones that have the talent and experience and grit to get done what you need to get done. And, you know, I will honestly say my experience has been starting with values. We have not suffered for high quality candidates. My experience is that people that you want to work with who are good at their jobs and who are successful are often successful because they are deliberate in how they go about their life. They're values oriented in how they manage their careers. And so it's just in the same way, you know, we don't have a diversity program at Yogo, but we're, you know, half our company is women. We have a lot of, you know, first and second generation immigrants, a lot of diversity in our workforce. And we've done nothing other than go out and try to find the best people. And it turns out when you hire the best people, that tends to look just like the communities that you're recruiting from. And I have to ask, you know, if you are recruiting poor people and your company is full of white dudes just like you have to recognize that is a choice you are making. You are choosing to recruit in that way. You're making recruiting choices that are failing you, and you need to go back and take a look at what it is that you're doing exactly, what you're selecting for, because you're clearly not selecting for talent. Because if you were selecting solely for talent, you would have a diverse workforce, because talent is distributed in a diverse way through the population, right? You would have half your company would be women, because there's nothing gender specific about being smart and talented. So, you know, that I think is just be, you know, really consciously introspective, right, about what it is you are really selecting for, and don't just like talk to people and try to establish a rapport, because you're just going to find people who are just like you. Actually construct a recruiting criteria and make it a scientific process, right? And that's the approach we take, and so far it's worked, I would say, very well for us. And not that we haven't had hires that, you know, didn't work out or whatever, but I think our percentages there are you know, very favorable from our point of view. And, you know, our people who work at a company love to work there, and that is very little to do with me and much more to do with all those people and how they think about their colleagues and their work life.
So let me turn to Kellen. You guys started as a European company. You now are in the US. How do you go about finding talent?
I guess to connect it with earlier conversations, I would say treat the talent kind of like the end customer as well. So do profiling do your research of the types of candidate that you would like. And I think similarly, at least for me, when I've had to recruit in this role, it also then comes down to a little bit of selling. So whether it's positioning values or what you think that that profile would be most interested in, I think start working through that. I think fortunately, there are a lot of tailwinds, I guess, when it comes to recruiting for startups, because there's been so much success stories. So you have that kind of at your disposal. But I would say, understand, startup life, especially early stages, is a unique personality. I think you can drill down into what drives that, understand a few things from the individuals, that they would be inherently ambitious, that they would want to think big picture and be part of something. And I think you just tap into that and then try to validate it how you can with why they should care and what's in it for them. So I think it's a selling opportunity to recruit.
Great. I I totally see the challenges in finding the talent, but I also think COVID's done us another favor in teaching us how well we can work remote and being able to expand where our talent comes from. So we're quite close to the close. I think we have about just enough time for 1 minute each. And if each of you have one last thing that you would say to our audience that would help a startup. And let me start with Natalie and give you each just 1 more minute, and then we'll be off the air for today.
Well, I think I would, I mean, there's lots of good messaging shared already, but I think the one thing I'll say is, you remember when you used to listen to a story as a kid, certain stories really resonated with you and some not at all. And it often came down to the narrator, right? The person in the classroom that was reading out loud. Well, think a little bit about that, because it's the same when you're telling your story. For one, have a good story. In other words, understand the beginning, the middle, and the end. Do your, really do your competitive reviews to see where you sit in the market, and build a story around your vision. I think it's underestimated massively how important it is to be a good storyteller as a CEO or as part of an executive team. So think hard about that and practice, talk about it at the dinner table with people, see if they care about what you're talking about. Because if they don't care what you're talking about, an investor is not going to care, right? So good storytelling.
Good storytelling. All right, Courtney.
I've loved this conversation. I think, Michael, one thing you said that really resonated with me was the frame of empathy, and then kind of how, I feel that permeates our entire discussion today, and thinking about, there's talent, and thinking about it through the empathetic lens, and then thinking about also in terms of figuring out your customers, what their jobs to be done is, and kind of from there, you can develop a sound, business model, go-to-market strategy around that. But then the one thing that I wanted to kind of drive home is thinking about healthcare innovation in the US and everywhere, is that an individual's health is not bound to just medical care. I think that's one element of a person's overall health and well-being, and thinking about, 75% of a person's health is everything but. So what their conditions are outside of the moment they have to interact with the provider. And kind of that's one thing I motivate all of our companies to think about. They're designing solutions for patients who, are healthy individuals who, quantify everything they do, versus people who are super high risk and come from more kind of vulnerable communities. And having that empathetic frame is the one thing I wanted to just bring up.
Great, thank you. And Kellen.
I might sneeze in the middle of my response, so I apologize. But one, I think what Natalie said about storytelling, yes, from my experience with founders or working with other CEOs as well, it does make a humongous difference. The other thing then, and it may sound a tad pat, is focus and prioritization. Is in the beginning stages, there's just so many different areas that you may be kind of pulled into. There may be opportunistic things, and I think maintaining and sustaining focus on what truly matters to either get set up or whatever that next goalpost is imperative. Otherwise, it can kind of just either lead to burnout or not getting anything done.
Great. And Michael, let me give you the last word here.
Wow, that's quite a responsibility. So, I mean, I think Kellen and Natalie and Courtney have given some really tremendous advice. And, you know, go seek advice and take it, right? And, you know, and get lots of it. You know, diversity is really important here. I'm going to end though on something that is really important to me, and I just encourage everybody to think about it. There's something that really dangerous that is happening in our society right now, and it is related to a lack of respect for reason and science. And we are letting pseudoscience creep in around the edges. We are destroying the epistemological foundation of our common understanding of what is true and not true. And we cannot allow this to happen. And it is especially dangerous in healthcare when people's lives are at risk. I have a lot of people in my extended network that are very involved in alternative medicine, alternative therapies kind of space. And, you know, those are legitimate avenues of inquiry, legitimate avenues of rational scientific inquiry. They are not legitimate avenues of just tricking people into giving you their money because they believe something. And I think that is very important that we all construct you know, ethical business models and take an ethical approach to our work, and be aware. Don't let pseudoscience just pass by. You must challenge it. We all have a responsibility to challenge this, whether it's, you know, in a business model that looks unethical, whether it is a product that clearly can't do the thing that people are saying that it could do, you know, or some other area of society. You know, we have to take some responsibility to really apply our best thinking, our best reason, and our best ethical approach to the work that we're doing. So I just encourage everybody to keep that in mind as they're going about their day.
And important as we all look for different solutions. Thank you very much to all of our panel members, and thank you to our audience. I hope you've found things that you can take away and are valuable. And if you're looking for some coaching and mentoring as you grow your startup, remember that Venture Labs is here and has a great team of mentors and great member companies, all of which are here as an opportunity to help you along your path.